Yeah, so we have both surgical and non-surgical options. The way that it's done is very different between the two options. One, obviously, is surgical, so it involves liposuction to harvest fat. And typically, the way that we do it here is we'll do liposuction all the way around. So upper abdomen, lower abdomen, waist, hips, mid-back, lower back, flanks. We'll take that fat and then we'll process that fat and re-inject it into the buttocks. So there's goods and bads to that compared to the non-surgical option. Some of the goods are, one, typically you can get more volume, obviously depending on the patient, depending on how much volume that they have to remove and to replace it into the buttocks. With the surgical option, you can also help to contour the body and sculpt the body more, right? So with the liposuction, obviously you're removing the volume, so you can flatten out the abdomen, you can really bring that waist in, give you more of that hourglass figure. Additionally, about 30 or so percent, about a third of your results are actually from the really aggressive liposuction. Because if you really scoop out that lower back, you really bring that waist in, bring the hips in, then you're going to give the illusion, even if you don't transfer fat to the buttocks, you're going to give the illusion that you have more pop to the buttocks, or that your buttocks is more rounded. And so just from the liposuction alone, as aggressive as we are here, then you can really give that illusion of a more robust buttocks. And then you add the fat to the buttocks. You can, a lot of people just want the sides of their hips, what we call the hip dips, filled in. We can do that. You can make the buttocks globally larger, more rounded, more projected out to the back. You can focus on if you want more of that upside down heart-shaped buttocks. I mean, it's very customizable. Where the surgical buttock lift differs from the non-surgical buttock lift, from, I wouldn't say a disadvantage standpoint, but from more of a consideration standpoint is, yes, there is recovery time involved. It is a surgical procedure. You will have compression garments to wear from the liposuction. You will have drainage. You will have recovery time. You'll have anesthesia to recover from. And with the fat transfer to the buttocks, we want you to stay off your buttocks for a minimum of 3 weeks, right? And there's lots of tips and tricks for that, and lots of ways to get around sitting directly on your buttocks. But what that's going to do is that's going to allow more of that fat that we harvest and inject to survive.